Guru Nation, we're live. Okay, thank you guys so much. LinkedIn, Twitter, Facebook. You'll see this on YouTube later. Today's May 15th. And if you're listening on the podcast and you're listening in the future, just know May 15th, okay, it's International M.P.S. Awareness Day. It's an extremely rare genetic disease, mucopolysaccharidosis, M.P.S. And this one's personal for Dr. Fox. You guys might remember Dr. Fox from previous podcasts. If not, go follow him. If this is your first interaction with him, maybe even better. You get to understand his why he's doing this. I'm wearing purple for International MPS Awareness Day. We urge everyone to do one violet act of kindness. Violet was Dr. Fox's daughter that passed away from M.P.S. 4 years ago. And
Yep.
Dr. Fox, you know, I'm starting to understand, getting to know you now over this last year. I'm understanding your why and your passion because when you post things on LinkedIn, you're super passionate, man. And a lot of people, especially now that we're involved with SOS, a lot of people think, okay, well, you need to tone it down, man. You're doing too much. And now getting to know you and getting to know your why, which is violet and rare diseases and how we can improve and do more. Uh, I don't think you should tone it down, man. This is the reason why you do this.
Yeah. Violet had she had a severe version of MPS called ICEL. So MPS being mucopolysaccharitis is like a family of diseases. Violet had ICEL, which is literally called mucolipidosis or mucolipidosis 2. There's actually numbers. There's one called Hurler's. Hurler's is one form of it. It's a little more common. Violet, she just struck the lottery on rare disease. Unfortunately, she was uh, straight up mucolipidosis, the most severe you could have, 1 in 600,000. So put that into perspective, like in San Diego, when we got the diagnosis at Rady's Children's Hospital, there was a geneticist who who looked at her and he said he's only seen two of them in his 30 years of his experience at Rady's. So she was very, very rare. She was rare in the disease level. These children have it's almost like a thickening of the lipid bilayers in their cell membranes, which means that they can't import the resources that they need to survive. And as a result, they also can't export the toxins. Violet was 4 years old when she died. She was 18 pounds. She was maybe like, foot and a half long. She could never walk. She just crawled. We gave her a salad bowl, and that was her walker. So she was walking around the floor on a salad bowl, and she couldn't talk, but she was so smart. She did so many things that she was right there. But that last year of life for Violet was very painful. You could just see the pain in her eyes. Her body tried to keep growing. It tried. Her wrists were the same size as her shoulder. I mean, her joints were trying to increase. She kept trying to grow, but her body just wouldn't allow it. It was an enzymatic disorder. Um, and so it was very painful, not only for her. She had to live off of NSAID. We had to give her pain meds. We just had to try to keep her comfortable, but it's been painful for the whole family. And this goes back into grief counseling and a lot of the grief. If anyone out there has known someone who has passed away, or they're trying to help someone get through passing away, there's the stages of grief, and you never really move on. You just move forward. It kind of just, you grow around that scar and you keep going. This is actually the first year where it's an equal amount of time where Violet's been gone versus we've had Violet. So we've officially been without her just as long as we've been with her. So, that kind of puts it in perspective. She died on Christmas Eve. I'll send you the picture sometime if you'd like to see it. But I have the last picture of me holding her, and she was just miserable. She died, or no, she died. I held her on Christmas Eve, and then I found her on Christmas morning dead. So she was gone. That's, Scarlett, our other daughter. She had to open up two sets of gifts that year and have two stockings. And we're trying to have family Christmas while we're waiting for the uh, everyone to pick up her body and all the nurses. And it was a very challenging time, and it caused a lot of pain for me coming back to the drive. It was sitting there as a scientist, not being able to do anything for my daughter, like trying. I was in the industry. I reached out to people. I
This
tried to
was
find
this was
help.
when you were a
I was a
site
director.
director,
I
right?
was a site director, and
Mm.
I did everything I could to try to find her help.
But you
And they
couldn't find anything in Illinois. You had to go to San Diego at a
Well,
specialist.
no, we had the diagnosis. We lived in San Diego when we got the diagnosis.
Oh, I
Rabies.
didn't know you lived in San Diego.
Yeah, we lived in Hamul, over in the mountains of
Oh,
Hamul.
that's right. Okay, okay.
So that's when we
Wow.
got the diagnosis. And Rady's, they were so kind. But even then, at Rady's, really, really big place in San Diego, they couldn't do anything. So we went back home. Nobody in the country would had anything for ICEL. In fact,
Wow.
there were some advancements for ICEL. They successfully created a feline model to help to do ICEL research. They ran out of funding and they had to close down the feline model. There's random ICEL cats around the nation right now that are dying out. So we're nowhere closer to an ICEL advancement now than we were before. There was a biotech company in St. Louis who they were onto a mouse model, ran out of money. It's not worth it. And so then as a result, they shut it down. And when you're in these rare diseases where children die early, you've got a very short flame of time for people who are advocates for it. And then when the children die, they don't want to be associated with it anymore. They want to move on with their lives. And so you just move on to the next generation of people who have to go through the same exact pain. It is so this time last year, I posted M.P.S Awareness Day, right? Someone from Greece, someone from Greece contacted me. My child is 9 months old. I just got the eye cell diagnosis.
Wow.
And so I've been trying to work with them, going through the eye cell journey again, trying to be almost like a grieving parent mentor, where they have that fire in their hearts. They want to do something about it. And guess what? It's no different than when I went through it. There's no
Hmm.
research. They're trying to raise the funds. Odds are there's no way we're going to help their child, and we're right back to where we
It's
started.
yeah, and Stephanie, I concur. Sorry for your loss. May Violet rest in peace. You know, she's watching over you, like I told you yesterday,
Mhm.
from above and cheering you on, and she's your biggest fan, man, and she's she wants this SOS to take off and do big things for the industry. Do you think this particular disease, MPS, do you think it's as simple as like maybe something like gene therapy can fix, or
Yep. So they're Hurler's MPS3. Hurler's is the one that they're targeting first because it's one of the more common versions of it. Yes. So they're
are they
looking at,
doing anything right now?
yeah,
Like,
they're close to CRISPR. They're doing a lot of the things for Hurler's. We're
wow,
we're generations of eye cell children deaths away from an eye cell
because
therapy.
these genes would be expressed everywhere in the body,
Yeah,
right? Like in
it
every
is.
cell.
Yeah, so that they call it syndromes because it is a syndrome. It's fully expressed. Um, so
Mm.
the CRPN logo in the back, those three triangles, is very intentional. The whole
Huh.
idea of that logo, the three triangles with that circle in the center, you can kind of see it on my screen. The circle is the patient, and the three triangles are the sites, the sponsors, and the CROs coming together around that patient to try to care for that
Wow.
patient.
You know, I never
And
noticed the three triangles there ever. And
yeah,
I've interviewed you half a dozen
mhm.
times.
and that centers the patient. But then the colors were also very intentional, and one of the colors is a magenta kind of a color
Hmm.
for Violet. So Violet's
Mhm.
right there in the CRPN logo. She does everything we do, and part of it goes back to what I was saying when I was a director, when we were going through this with Violet. um, I was negotiating all kinds of trials, and I was looking at this, and I saw as the ISL community, like they put their hands up in the air, and they did this, but there was um, there was this feeling. I guess I was trying to make it logical as a scientist, saying, okay, if I had to put $2 billion into the development of a drug, I'd want to try to make the most bang for my money. I'd want to try to help as many people as possible. And unfortunately, when it comes to rare diseases, it's almost like saying, well, if things are so expensive, it felt as though the industry was trying to tell me, like, my child's life wasn't worth saving because it was too expensive to try to help her. And
Yeah.
that was, it was really hard as a scientist to say that. But now that I'm going through what I'm doing and I'm seeing what's going on, it's not that my child's life was not worth saving. It's that we are so inefficient that we can't help these people. So when I go
Yeah.
through and I look at these contracts, or I'm trying to fully fund a trial so that we can try to get these patients through, everything that I do is to ensure that we can be efficient and we can help as many people as possible.
Yeah.
Because even right now, I mean, I'm sure you're going through it, but across my network, I have negotiations going on right now. Some of these negotiations are 1 month old, 2 months old, 3 months old, and it's not the patient's fault. It's not even the site's fault, but
They don't even know what's going on.
they don't. I don't think the people realize when they drag their feet, or they don't get the site their budget, or they don't renegotiate to get the sites what they need. I don't think these people realize what they are doing to patients by delaying this. They're focused so much on, money. We're working on trying to save money for our sponsors when actually they're cutting their sponsors' throat. They're working on trying to make the best possible margin because of who knows what. But the one thing I could say is every delay, every time they screw sites out of money, it's blood money. It is truly blood money. And coming from someone who has literally experienced that hopelessness in an industry where people just keep moving on, but you don't feel like your children are worth saving because of what your industry is doing. It is
Man.
absolutely infuriating. So I've seen the terms abrasive. I've seen the terms, maybe that's a little much. I've even seen the terms, maybe you're just going to get like kicked out of the industry because you're being too loud. You know what? I don't care. I honestly don't care. I'm doing
No,
it. I'm
that
doing
won't
it
happen.
for the patients. So,
It won't happen, especially these trials. I mean, with gene therapy, and I'll tell you off camera. There's a rare disease study that my CRO. You know how me and Chris have a very small
mhm.
CRO. We get approached by projects here and there, just small IITs. There's one that I'll share with you afterwards because we don't have it locked down yet. I can't talk about it, but after this interview, I'll share with you.
Yeah.
It reminds me a lot of this, but basically, we are our industry. You know how we say, okay, we're getting more complex, and um, we're actually to the point where we're doing studies just for one patient. Um,
hmm
so,
Customized, tailored
cus-
medicine. Yep,
yeah,
it's coming.
yeah,
It's on its way.
it's actually here. Like, I'll share the story with you off camera, and then when we're ready, we'll go public with it. But there's people out there that have done it for just one patient at a time, and then they want to scale it up for others afterwards. So we're getting there. I think you're going to see it really soon. CRPN is going to play a role. SOS is going to play a role. Like, we're all going to have to play a role. All this Creo, Versatrial, all these tools
hmm
help anything that increases efficiency. is literally saving lives. I mean, we try to stay away from hyperbole on these things, on these
Mm-hmm.
live streams, like, oh, how does a Versatile save lives? Well, actually, it does. It keeps the coordinator more organized. It buys a patient an extra day. Sometimes that's
Mm-hmm.
all you need.
Yeah, especially in screenings and enrollments.
Hmm.
If you can get all of the patients in within a month instead of over the course of 18 months, you're going to have that technology to be transferred. And
Samantha says, came to learn about M.P.S through my interaction with Paradigm Biopharmaceutical. Are you familiar with this company?
no, I don't. I'm going to have to
I
look up
actually did a
Paradigm.
study with them.
Really?
Yeah, I gotta stop making fun of them. Because if they're working on these rare disease, and they are a rare disease company that also does some
Mm-hmm.
non-rare disease stuff. And
I
uh,
think uh, I think there's a company called Ionis Pharmaceuticals. I think they're the ones that came out with an MPS3 therapy that they're working on.
Samantha, see, this industry is moving so quickly. Dr. Fox does not, and he studies this stuff. They're
Mm-hmm.
phase two comparing
Yeah.
injectable pentosand polysulfate into placebo. Wow.
Mm-hmm.
I'm doing
Yeah.
this similar study, but not for MPS.
Yeah. They're doing MPS4. So I mean,
Wow.
it's coming. So the
And Violet
MPS,
had
yeah.
two, right? You said two.
No, Violet had the rarer version of MPS called ML.
I see.
So she was mucolipidosis. She wasn't mucopolysaccharitis. So
I see. I see.
you know that your rare disease is so rare that there's not even a day for it. So they try to bend it into
Right, right.
another awareness day.
So this one's mucopolysaccharidosis type 6, or is it type 4? Maybe it's typo.
It could be six. There's a huge
Wow.
spectrum of MPS.
Wow.
Yeah,
And they
and
are
I
doing
think
great work in OA. There you go. You caught me.
there you
That's the
go.
study I'm working
You
on. The
got
same
it.
drug. Same drug. And there's a CRO involved that we've worked on in the past. And a lot of these biotechs, they rely on these CROs to help them out. And I think for the most part, like the CROs do have good intentions, but you know, the the inefficiency that's sometimes created by just the mundane, I guess, repetitive workflow
Hmm.
is at the end of the day, like there's a bigger price to pay than just sites being unhappy.
Yeah, yeah. It's I mean, sites being unhappy is one thing. That will come with the territory. But this goes back. I'm seeing one of David's comments, and
Yeah.
that's so. I really do think, and this is why I'm affiliated with whom I'm affiliated with. But I really do think that the technologies like MedVector will be the answer to David's question.
Hmm.
When you can integrate research into healthcare, where you can just approach a
I think
doctor
so
that
too. I think so
when you
too.
can approach a doctor that knows a patient's story, that can be a part of that research journey. And then you have like little site community hubs. Those IROs, man, those community sites, they're going to be the future research because they're going to have those relationships with local physicians. Local physicians will go to the research thing, say, hey, do you have a trial? Okay, we'll run it right here in this doctor's office.
Hmm.
I think that's going to be the answer. I don't, and AMCs are going to try to maintain the hub because they're subsidized. Honestly, they
Well,
can
shout out to
do,
some of these
yeah.
AMCs, David. Right now,
But
it is
I mean,
AMCs.
it is going
Well,
to be AMCs, but I think it's going to be the future for community research.
I think so too. What a lot of people don't know, and I'm one of the biggest critics of AMC from a career perspective. Like, if you're a career seeker, I mean, I think there's better places to grow your career unless you like that kind of environment. And it is for some people. The AMCs are doing a lot of these studies for free.
Yeah,
Like,
yeah,
I know about at least 5 of them that have agreed to do these rare disease studies for free.
yep.
For
Well,
free.
they get state subsidies. It's free
Hmm.
because they have other routes of money.
Hmm.
If you've ever worked at an AMC, though, you've ever tried to ride the grant waves that AMCs have to do, it's cutthroat, man. They have to depend on publications for their livelihood.
Hmm.
It's financially free, but at the cost of what?
There's other incentives for them.
Yeah, yeah.
Yeah. And then Samantha says type 4. But
Mhm.
you're right.
Type 4.
You're right, Daniel and David. I think Tech, maybe MedVector, one of your sponsors, um, a, an organization, a tech that I'm trying to start to use here in Yuma, not for rare disease, but just to expand our patient capabilities. So we'll see how that works, but
Mhm.
it definitely has a lot of potential. Also, things like eSource and eReg, Creo
Mhm.
and Viva. I mean, if you can cut down that monitoring and let's say just get these, let's say get the data approved quicker.
Mhm.
I mean, that also saves a lot of time and can help a lot of patients out at the end of the day.
Yeah.
Maybe
Well, and
dozens of patients for a rare disease.
CRPN. It's that's my plug. But the whole point is you knock away those 3 months of site startup events. You don't have to negotiate every single trial. You can literally treat it where you give sponsors something equivalent to an insurance card, let them walk into sites, give their insurance card, and get the trial going.
Yeah.
There's ways that we can integrate research into healthcare. We just have to follow their models.
I'm curious. And Samantha says, apologies, it's type 6.
Type 6.
I just learned about this weekend from Dr. Fox. I mean,
Yeah.
I never knew there was such a thing as International M.P.S. Awareness Day. I actually asked ChatGPT to help me out, and it was not aware that it was International M.P.S. Awareness Day.
This was a weird one because yesterday was Mother's Day.
Mhm.
And when you combine Mother's Day, so of course it's always kind of a weird, bittersweet Mother's Day here in the Fox household. But then the
Mhm.
day right after is M.P.S. Day. This was a kind of a weird year for it. So
Yeah,
we always wear purple for violet, is what I call it on M.P.S. Day.
on
And
M.P.S.
then
Day.
we always go through and we perform what I call a violet act of kindness. And it's literally just if you find yourself in a situation where even if someone's trying to reach something at the top shelf and you can get it for them, or they dropped something, you pick it up, or if you even have the money to do it, buy someone's meal who needs it. Any kind of a violet act of kindness, it's really helpful to maybe just let her memory live on and what she did every year that we do it on M.P.S. Day.
Yeah, that's why I'm wearing the purple, and we encourage everyone to do a violet act of kindness. So something random, nice for someone else. Um, I'm curious, Dr. Fox, pre Violet, okay, um, were you the same passionate guy you are now, or I didn't know you. All I know is this version of you, the one
Uh,
that people say calm down on the memes, man. You're too aggressive.
I've I, No, I think I've always been a disruptor. Sometimes, honestly, I don't even know the person I was before Violet. It's just kind of been a part of me. But looking back, I mean, I've earned gold medals of achievement. I've been the top of my class. I have I don't know if you see on my wall, but I have all of these awards, all of these things. I think that I used to be restrained by fear. I used to be restrained by worrying that something might happen. But I guess the only thing you can say is after you've lost a child, especially after you've lost a child where you lost all hope, there was no chance you could have helped. There's really, not to sound it's not suicidal, but it's literally like you cannot possibly feel any worse pain ever. And so as a result, you're not too worried about what people think of you. You're not too worried about the consequences because you've already been as low as
As
possible.
low as, yeah, I guess
So it's like,
unfathomable for most people.
yeah, and anyone who has been in that situation where, um, just, so when I woke up on Christmas morning and I was the one that found Violet dead in the crib. Granted, I have been a scientist. We're on a farm. We deal with dead animals all the time. I had to do that. But when it's your own daughter, they're completely stiff, not there anymore, just a corpse. It changes you But I do remember the one thing that I did on Christmas was when they came with the hearse. I said I want to be the one to take her into the van. I will pick her up. I'm going to take her those last few steps. I'm going to put her in that car. So I'll never forget that part. But when I approached that crib, picked up that very stiff body, and I took her, walked her out of the house, walked her down the driveway, and put her in that van for her last trip in the car. Um, that was very symbolic for me. I got her through the journey. I I made a promise to her that I would take care of her until the very end, and that was a big moment for me. And
Mm.
that level of pain is the one that I'm not sure. I mean, I wouldn't hope it on anyone, but I'm sure anyone listening to this right now who's had to go through that knows exactly what I'm talking about, where I will spend the rest of my life with this fuel, with this passion to make sure that other people will not feel this pain. And if anyone feels as though this is too much, I'm sorry, but that's my mission. I'm just going to keep going until I can't go.
I know the logo has a lot to do with violet, as you mentioned, the purple. Do you was this CRPN like something you were gonna do before Violet was born, or was this like?
No, this CRPN was developed when I was directing in Illinois. Violet was here,
Mm,
and I started CRPN. Actually, I started it just after Violet had passed away, but it was driven by the fact that there are patients who are suffering, and it's not the patient's fault. It's not even the science fault. It's just because we as an industry do not function our processes efficiently.
yeah,
And it's infuriating when you see. I mean, I wish I could show you the letters to our sites that we receive, and every single one of those sites has patients that we could help today, but we can't because there's someone in this industry who they're holding us back,
yeah.
and they're holding us back for really stupid reasons.
What do you think? What's the one thing that you think you could change to make things exponentially better in our industry?
That's for me, it's the money part. I feel as though, and again, I just call it metal and paper. It's literally just a bunch of metal and paper, and we are the ones that put value to it. But if you use it as all it is just a tool to go get to from one point to the other, a tool to get the job done, it's really not worth that much. And
Hmm.
I do believe that we as an industry need to take a look at that as just the tool to get the job done. The job done being to get our patients the care that they need. And that is the one impact that I want to make. I want to make sure, just as I say in CRPN, that our sites have everything that they need to get the job done when they need it. And
Yeah,
when that happens, we're going to do things faster and we're going to help more patients.
and that includes AMCs
That
in
includes
your
AMCs.
opinion, because they're the ones on the
Absolutely.
forefront of these genetic disease studies
Yes.
primarily. I mean, they're the
Yes.
ones equipped to do it right now.
Yeah. Unfortunately, AMCs have so many political
Mm,
barriers that
yeah,
I think what'll happen is when community centers start to gain access to the research that AMCs do, and when we can make it very efficient, I think you're going to see it really explode.
leveraging tech,
So,
leveraging tech for
hmm,
the community
yeah,
sites.
oh yeah,
And as far as the money's concerned, so you're obviously the school of thought is for CRPN is let's make life easier for the sites, let's make life more profitable for the sites.
hmm,
That's going to
yep,
help the patients quicker.
yep.
The biggest holdup in your experiences where during the contract negotiations or during, like, if you could fix one thing, if you I used to be on Clubhouse during COVID and they said if you could have one magic wand and change something about this industry, so would you change the contract negotiation or would you change like the actual
Mhm.
operation of how sites do the studies?
Gosh, that's like asking what you want for Christmas. I think it's going to be a huge combination. So if you make it efficient and you allow the sites the ability to create a margin, and this is what I've said before, most of the sites, even some of the AMCs, they're living in the dark ages as far as technology
Yeah, yeah,
goes.
most sites and most
Most.
AMCs.
And the
Yeah.
reason why they're living in the dark ages is because they don't have the margins to reinvest in their future. They're always in survival mode.
Hmm.
So if you can empower them with the resources that they need
Wow,
when they need it, and if you
that's
can
true.
empower them with money, believe it or not, if you were to give sites money, excess money, they would be able to reinvest in their infrastructure and we would be able to have a better future for research. But since we're so top heavy, meaning all of the money's at the top, it trickles down to the sites, and sites are literally scraping the bottom of the barrel just to survive. We're always going to live in the dark ages. So I
David,
guess,
oh, go ahead.
go ahead, David.
David has a good comment here. His favorite verse from Macbeth is, "Don't let your grief be equal to her worth, for then it would never end."
Hmm.
And that's really
Yeah.
a good way to put it. Uh, I mean, Violet's here. Violet's always gonna live through your work,
Hmm.
and I'm glad I did this interview, Dr. Fox. It gave me a greater understanding of you. You're my business partner
Hmm.
on a couple things, and
Yep.
I didn't have this insight, the full insight. I probably still don't, but I have like a much clearer view of your why, and it's clearly extremely important to you and to our industry.
And I appreciate you waking up so early just to talk to me on
it's,
MPS Day, Dan.
it's an
It
hour
means a
earlier,
lot.
man.
And
It's
I
worth
try
it.
to be chipper. I try to be spitfire, but these are the things I don't talk about because I don't want
Mm.
to live like this forever. You become comfortable with living your new life and you don't want to relive the past. But I did want to bring it up this year only because of a lot of the things that are happening right now. I want people to understand the origin story, like why I'm doing what I'm doing. And there's a good reason.
Yeah, I guess it goes back to that. You never know. Be don't be quick to judge. You never know what somebody's mission is, what somebody's
Hmm.
going through on a daily basis, on the in their life. Um, so yeah, it's. I think we're happy to have you as part of. We're honored to have you as part of SOS, and we need that passion and that fire. I mean, that's how change gets accomplished.
Hmm.
It's with passionate people who have a bigger why than just, hey, let's increase profit margins. Let's add
Yeah.
another revenue stream. That's not one of the reasons I wanted to do SOS as is, but we have somebody who clearly has a greater purpose than the rest of us, and it's super important. And I think
Hmm.
patience. It's easy to forget patience, when we talk about patient centricity and this and that, but it's easy to forget that we're all patients at the end of the day. I mean, this could be any of us. There's thousands of rare diseases. There's what's the stat? 1 in 10 people have a rare disease. They're not so rare after all.
Hmm. Yeah. Well, we're all different. I mean, that's all there is to it. We all have a different makeup. And tailored medicine, I remember they used to say tailored medicine all the time. And then I think COVID got in the way.
Used to sound like
Maybe.
science fiction. Now it's like, yeah, I mean, it's
Yeah. It's
obvious.
like, yeah, here's your profile. We're going to know exactly what to give you when you do it. We used to do that in hearing. There was a big push where we were going to do diagnostics in hearing protection so that you
Mm.
could have tailored antioxidant combinations and cocktails for your specific hearing needs. There's all kinds of ways that you could do this, and it's gonna happen. And then big shout out to the M.P.S folks. So I know that there's a lot of people hurting out there, and I really want them to know that research is coming. It's gonna be on its way. Don't lose hope. Do not lose hope ever. You can't.
Mm-hmm.
So,
And shout out to the sponsors working on this stuff. Like,
hmm
I mean, I'm working with these guys on a study right. This is one of the reasons I had to leave early, wake up an hour early. We're screening a patient
wow,
for these guys today for a OA study. And
congratulations.
shout out to these sponsors out here innovating. Like, who would have thought pentosand polysulfate sodium used for years for
You know
interstitial
what?
cystitis? You know?
It's not Ionis. It's Regenex Bio.
Hmm.
Regenex Bio did an M.P.S drug, and they're working on it. So a lot of those genetic factor ones. I'm sorry,
Shout out to
Ionis.
these biotechs,
Yeah.
man. I mean,
So
we don't credit the innovation in our industry enough. You know, and people like myself, like you, like Brad, we get accused of making fun of the industry, its inefficiencies, and yeah, there's jokes. Like I'll throw jokes in there for memes, but the sponsors are out there innovating, man. These
hmm
guys, especially the small to mid-sized ones, they're out there. That's their mission. That's their business objective is to innovate.
yep.
They
Have you
take
ever
products from the past and make them better and find different applications for them. That's what I love about this industry.
have you ever worked at a sponsor?
No,
It's
I plan
cutthroat.
to in the future.
It's cutthroat. It is. You're always. You think that sites are having a hard time always chasing the money like that? Imagine trying to be at a sponsor where you don't get to depend on multiple people to give you money. You have to depend on investors to
Yep.
put all of their money into a single technology. It
Investor, the
is.
public markets.
Yeah. It
Once
is.
you go
It's.
public, you have to deal with all those meme people. You think we're bad at memes? You should see the stock memes
Oh,
people.
geez. So it's. I mean, I
Respect to
know.
them, but it's man, it's
Yeah.
necessary. This book, everybody should read it. This is the cost
Mm-hmm.
of taking a drug from an idea to market. And
Yeah.
it's basically all about biotechs. It's not that big. I'm trying to get the author on the show, but they're ignoring me. I'll just end up reading the book myself over a series of podcasts
Yep.
live for people. But
So big shout out to the sponsors and thank you for giving those patients hope. I'm telling you, especially those genetic guys.
shout out to the sponsors. Samantha, glad I joined today. Dr. Fox, sincere condolences to you and your family.
Thank you,
I will do what I
Samantha.
can to honor Violet's memory. Myself as well. I think we all should. You know, a Violet act of kindness. Like I told you, she's up in heaven watching over you, man, and cheering you on. Your biggest fan, and everybody keep in mind, you know, what the actual big picture is here, and it's patience. We could all be patients. We are all patients eventually. Dr. Fox, everybody go connect with him. If you're listening, his LinkedIn is underneath. If you're watching, you already know where to get Dr. Fox, but check him out. Thank you so much, Dr. Fox. I
Thank
appreciate
you,
it.
Dan. And thank you, everyone, for watching.